The only thing I needed to change was every other joint that accepts load in a closed kinetic chain. Because sometimes that's why in my lecture I talk about respecting the pelvis, because there are certain things, again, if someone if they grow up sitting like this, right? Like often people sit like this. They don't always sit like, so one hip is an IR, one hip is an ER. So this hip is always going to be limited in IR, and this hip is always going to be limited in ER. And that's what I see often is people who are severely limited in IR on one side, where I know I talk about the patterns of flexion and IR, and I'm more concerned about those because those are the ones that you really need to be able to accept load in the closed kinetic chain. But you'll often see on the opposite side, if they sat like that their pelvis just developed that way because they sat like that for years. And you may not be able to change it. So that's why I talk about, is it tone or is it bone? If you try and you try and you try and the end feel doesn't change and it seems particularly bony, I would give up on stretching that and I would focus on, working on the mobility of the other joints and then just strengthening the hip, because at least strengthening will also enable the joint to be able to better accept load.